Okay, so on Mom Confessions on Instagram, a mother sent in a question, and I felt that I need to respond to this and give my own advice, my own tukobo. And she said, my 5-year-old is growing an extra tooth behind her other teeth in her lower jaw. The dentist said they have to remove the milk teeth, about 4 of them, to give room for the one behind, which is a permanent one. The x-ray done shows more tooth about to grow from behind, and her concern is this. My concern now is the milk tooth are not due to fall out yet, not even a sign, and I don't know how it will be for a toddler. Her concern is the pain and the fear in their mind. And so she's asking whether there are other moms that have gone through it and, that can lend their voice. So let me lend my voice to this question. So, mommy, I understand your concern. Let me start by saying that usually children have 2 sets of teeth. Every human being has 2 sets of teeth. The first one is the milk teeth, like you rightly said, the baby tooth. And that is the tooth that comes out when the baby is about 6 months, baby teeth begin to grow. Now, when the child is about 5 years, in fact, this time around, they even start earlier. 4 years plus, some children begin to bring out their adult teeth or the permanent teeth. So usually, the teeth develops inside the bone, and the adult ones develop a little more towards the tongue when they are developing. If it's in the upper, more towards the roof of their mouth. So when they are growing into the mouth, because all those teeth come out at different ages, all right? They come out at different ages. So the ones in front, which are called the incisors, and then one of the first permanent molars, those ones usually come out between 4 to 6, 7 years for some children. Those are the first set of permanent teeth that come out, and then others come out at different ages. Now, because your concern is mainly in front, when those teeth are coming out, the adult ones, remember that I said that they develop a little more towards the tongue, or if it's in the upper teeth, a little more towards the roof of the mouth. For some children, when they are coming into the mouth, they are coming out behind the baby ones in front. So some people say, oh, my child is having double teeth. It happens in some children for reasons that we don't know, okay? But it is advisable to have those baby teeth that are retained. We call them retained deciduous teeth. We need to have them removed early. Now, if you don't remove them on time so that it can create space for the adult ones to come forward, several things can happen. One, the child can end up having tooth decay because food is getting stuck in between the baby ones in front and the adult ones at the back. And so you can have tooth decay for teeth that naturally should not have tooth decay. The gums around there can become swollen because it might be a bit difficult for you to brush. But most importantly, if we take out the baby ones that are there, because they are retained, ideally they should fall out, but they haven't fallen out and the adult ones have grown behind. If we take them out on time, the child's tongue can help to push the adult ones forward and make sure that they are better aligned. More often than not, if we don't take them out on time, the child may end up having teeth that are not properly aligned. So, mommy, please don't be afraid. I know your concern is that, would it be painful for the child? Trust me, extractions in a child, you can't even compare it. The doctor will give the child a local anesthetic, something that will make the extraction very, very painless. In fact, by the time the tooth is out, the child will not even know that the tooth is out. So please, there are more benefits to taking that tooth out than leaving it in place. Now, the second thing, like I always say, people need to take their children to see the dentist regularly for the simple reason that we get to monitor the way these teeth are coming into the mouth, because it can happen in front and anywhere else. You can also have retained teeth, even at the back, okay? So these teeth, if they're not taken out properly, they prevent the adult ones from coming into place. And then you can end up having more severe or more complicated dental procedures like braces and all of that. If we take them out on time, a stitch in time saves 9. It saves us a lot of headache. So if you have a mom who is concerned, please share this video, like this video. The dentist is your friend. Thank you.